Hi, everyone, back to healthcare. Sorry for that short break. We are now switching our attention back to the peer certification bill, which is currently a committee bill. And we had some discussion yesterday about the background checks that are going to be conducted and how the background checks results will factor into the whole peer certification process. So I asked Lauren Lehman to come in from OPR. Did she leave?
She ran out a second.
Oh, right there.
Oh, I'm sorry. Okay.
So Lauren, do you want to come up? I've asked Lauren Lehman from OPR to come in and walk us through the rulemaking process that OPR does. I thought that would maybe some education would help us get to resolution on this. And then depending on this conversation, we will decide whether or not we will vote this out today. Lauren. Hey.
Lauren Lehman with the Office of Professional Regulation and General Counsel there. So I can talk a little bit about the background check, and I can also talk about rulemaking and stakeholder involvement in rulemaking. The language that was added to this bill yesterday simply authorizes OPR to conduct background checks. It does not require us to do background checks, but the FBI requires state law to allow us to do background checks if at some point in the future, through rulemaking, the rulemaking folks and the stakeholders decide they want background checks as a condition of licensure. This would allow OPR to do those background checks. As currently written, a background check is not required for eligibility for that certification. So for the peer recovery coach or peer support. So
Hold on, go ahead.
When you say background check, is that the same as a criminal background check?
Yes.
Same thing. Okay, thank you.
You all might recall from our compact discussions that every time we have a compact and there's a criminal background check requirement in that compact, we have to make that amendment to our OPR's authorization to do the background check, or else we won't be able to fulfill that requirement under the compact. So again, this is just an authority. It's not at this time a condition of obtaining the certification. That said, during our application process, we do have a question that says, have you ever been convicted of a crime? And if you answer yes, we ask for the court documentation and disposition. And then we have a panel sit and discuss whether that crime has a nexus to the practice of the profession, how long it's been. If you have a DUI when you're 17, we don't even really stat that or discuss it. We just keep moving right along. There's no impact on your eligibility for licensure. If you have been convicted of fraud and you've applied for a notary license, you might get what we call preliminarily denied. And that is a preliminary decision. People have then a right to due process where they can have an attorney, they can come through, be heard by an administrative law officer, have evidence presented, they have appeal rights. So there's a very full process there. In this situation, once you have a license, you also are entitled to that due process. In this situation, it's a certification. So even if your certification were to be disciplined or revoked in some way, you could still engage in the practice of peer support and recovery coaching. You would not be eligible for the license at that time, though, which would impact your reimbursement from Medicaid. All that said, the certification is supposed to be an indicia of safety, public stamp of approval kind of your qualifications. And so if it ever got to the point of conditioning or revoking a license or a certificate, it would probably be appropriate at that time. However, it's unlikely to happen. And so the concerns we heard yesterday, I don't believe any of that would prevent somebody from obtaining a certification and going on and working as a recovery coach. So that's that analysis. So now into rulemaking and stakeholder involvement. It's a very robust stakeholder process, both by law and by practice at OPR. So under the law, we have got the Administrative Procedures Act, and that has and it's 3 VSA 800. And 800 states the purposes of the Administrative Procedures Act. And that APA, as what I'll call it, lays out the rulemaking process, the purpose, number one purpose, maximize public involvement in the rulemaking process. So from the very get-go, it is a stakeholder-driven process. Formally, so before we even get into formal, OPR is a unique agency, and then we have to be incredibly collaborative. We have to work with 51 professions, from notaries to mixed martial arts, to pharmacy, to nursing. And so we have to work with those professions to set up standards. I am not an expert in any of those fields. I need to work with those stakeholders. I need to collaborate with them to set up rules. And so not only is it driven by law, but out of necessity for our agency to engage stakeholders before we even get into the formal rulemaking process. Our process, our best practices is what when we're even beginning to contemplate starting rules, drafting rules, we set up one-on-one meetings with any stakeholder that's identified themselves, or we'll reach out to stakeholders in other departments and say, do you know who works in this space? And we'll set up one-on-one meetings, meet with them and talk to them about their priorities in the rulemaking process, their concerns, what they'd like to see in the rules, what provisions, and we'll walk through authority. We'll take all their feedback and ideas at that time. We'll do that with, we'll look to who testified. We'll invite them for a meeting as well. And then we'll go and we'll take all the feedback we receive from one-on-one meetings and draft a set of rules. We'll also have advisors at this point. So we'll work with our advisors that are in the professions to help us draft those rules. Once we have a draft, we send it out to all the stakeholders again. And then we take feedback and comment. So this is really getting everybody on the same page and working together before we even enter the formal rulemaking process with our favorite first acronym, which is the Interagency Committee on Administrative Rules. So ICAR it's staffed by executive branch agency delegates, and their purpose is to ensure they look at the draft after it's been finalized by OPR with all of our stakeholders. They look at the draft and they say, they want to make sure the executive branch is all swimming in the same direction, so you don't have two rules that conflict with each other. They also make sure that there's a plan to maximize input, and they provide feedback on that in case you missed any stakeholders or anything like that. Once ICAR's approved your draft, the OPR then files that rule with the Secretary of State's office, another part of the Secretary of State's office, VASARA, and they publicize the rule. They publicize it online and they publicize it in the newspapers. And that starts the comment and feedback and public hearing stage of the rulemaking process. We typically hold at least 2 public hearings for 2-hour slots, depending on the rules. So we'll hold one during the daytime, usually, and one in the evening for folks who can't make it during the day. We always have both remote and in-person access. We have hybrid access so that folks can make it from all over the state. We do outreach before those meetings, both on our website and not just leaving it to, the SOS, but we do it through OPR's website and to licensees, to stakeholders we know. We'll send the meeting invites, we'll send agendas, we'll send draft rules. So we encourage all of that. Once and then we also have a specific email inbox for comments. We have invite people and we publicize that. So we invite people to submit written comments to us. All of these comments have to be accounted for in whatever final rulemaking we file. So we get comments. We need to, when we do our final filing with the Legislative Committee on Administrative Rules, or LCAR, we need to submit all of those comments, whether we've incorporated them in the rule and why or why not. So nothing can kind of be passed over. If you get a really negative comment and they don't like something, LCAR is going to see that, see how OPR addressed that in the rulemaking process, and why or why not in the outcome of that. The final stage is there is a public meeting in LCAR, and the schedule for LCAR is posted a year in advance. so that members of the public can attend and they can provide their input and feedback on any rules that are proposed to LCAR. LCAR can also object if it thinks the rule is outside the statutory scope, the scope of the statute and the authorization from the statutes, or if they don't feel like the public was sufficiently engaged in the process. And then after that, it's filed as an adopted rule. So that usually takes 6 to 8 months. We make multiple attempts to engage folks. And so that is the rulemaking process.
That's pretty extensive. Thank you.
That is really
Thank you.
helpful.
That was so
I had no idea. I thought there was only LCAR.
What
do you know?
All the
That's
cars.
great. Many cars.
All right.
Yes, Lauren, on page 2, the added language talked about it, the office may inquire on criminal background history. Yet on page 9, I'm happy to.
So I'm sorry, can you just say, what, are you on 2.1 draft?
Yes,
Okay.
2.1. In the yellow, it
Oh, there's
says
3.1.
J1, the office may inquire into criminal background history of the applicant. And on page 9, at the top line, that whole section on eligibility, it says you will do it.
Yep.
So I wonder why both are in there, but it sounds like the eligibility will apply and you will ask if someone's committed a crime.
Yes, I apologize. Thank you for catching that. So I had missed that was part of the eligibility. Right now as written is that they do need to pass a criminal history and registry check.
Okay.
As described in rule. So if there could be a more limited check, like the OPR, this doesn't specifically say that it has to be an FBI criminal background check. So if by rule they say the OPR question about criminal history is sufficient, then we wouldn't even touch the background check and need that authority from page 1.
Okay, so what you had said, you would say, if you committed a crime and they would say, like you said, they had a DUI when I was 17.
Mhm.
And then you would determine from that probably doesn't matter and off you go.
Right.
Okay, but there will be something so that somebody has to attest that they did or did not get involved criminally.
Yes, and this leaves it to rule to decide what that process
That's
would be,
right.
whether they
Right,
want it to be an
right,
FBI or they want it
And
to
I
just rely
understand
on.
that. Okay, so I just wanted to clarify that that's what it was.
I'm sorry I missed that. Yeah.
But I don't understand how you pass a criminal background check in this particular case. Because it may in fact mean I did something in the past that makes me eligible to be a peer.
So in this situation, what happens if you get a background check from the FBI is you get the results, you get a list of the history.
Yeah.
And so we would go through that same process where we would look at the history and determine whether there was a nexus, like a danger to the public really from that conviction and the profession. So if it's really attenuated, if there doesn't seem to be any threat, like if it was last year and something related to taking advantage of vulnerable populations, we probably would have concerns about certifying that person to be working with vulnerable populations. If that person, when they were 17, got a DUI and that's what comes back on that background check, we would not have any concerns with that.
No, yeah, I'm good about it. I'm going to be asking questions along that line as we go through.
Absolutely.
Because my mind, a peer is somebody that has experienced something that this person is experiencing now and can help them.
Absolutely. And so that's why I really want to assure folks that it's not an absolute bar.
Yeah.
Our concern would really, we're ordered not to regulate any profession unless there's a risk to the public from unregulated practice. And so what we're doing with this certification is putting a state stamp on it to say, if you're out there looking for peer support services, you can know this person's gone through training. You can know this person's gone through a background check. You can know that this person has that state stamp of approval of having that. You can get peer support from anybody, but you're looking for that individual. And so when we do an analysis of criminal history, we're really looking at whether that criminal history poses that risk that we're concerned about to the public.
It might even be a condition of employment.
Yeah, it might be a condition of employment, and that would not be regulated at the state level. The employer would decide, maybe I'm not hiring this person.
Like,
Brian?
So it was helpful to hear the level of detail because when I applied for a license, I don't know if it's the first time or a subsequent time, when I read the fine print, it said, you know, we have to pass background checks all the time. And I usually pass them. Like recently I failed one because I had a speeding ticket and I didn't know that would come up. And so I was like, sorry, you know, I got off the highway and didn't realize it. And my employer said, as long as it doesn't become a problem. In other words, like one time is one thing, but if you're getting constant speeding tickets, you know, or if a client was with you, it's another story. So like the employer has the freedom to make that decision with their staff. But the point is, what doesn't come up on my background check is when I went to court when I was in college. However, on OPR's forms, there is a thing that says you have to report any, I forgot the language, you'd probably find it quicker than me, even if you pled nolo contendere, it's been expunged. In other words, like even if you don't have a criminal record, you still have to report to be a clinical social worker to if you've ever had to go to court. And luckily I save everything. So I was able to find the ticket and I might as well tell you what it is, just so people don't think I did some horrible thing. I got arrested at a weapons plant. We were insisting that they let us inspect the Aegis destroyers in Bath, Maine. And we went with a bunch of like nonsense. No, just so people don't think I'm like a killer, you know?
That's fine.
And the
Let's
point
go
is, it
back.
was criminal trespass, but
Let's
I
go
don't
back
have a
to the
record.
question.
Well, I'm taking us there. Like, I just felt like I have to say that. So it's not like it's not creating some concern, you know? I was like in college, I did that. We went to court, we did court diversion, I did community service. I don't have a record, but I still had to write a letter explaining what happened, find the original ticket and the paperwork that I did it, send it to them. I never knew what you did with that. So now I know you actually someone reviewed that and made a decision. Okay, this is not going to harm the public because it isn't. I mean, but that being said, who determines for a profession that decision? Like, will there ultimately be the process you described where the profession and stakeholders determine like the rules and stuff? Are they the ones who determine what's the threshold at which it would be considered harm for the public? I think that's my question, because I don't know how you all decided that getting a criminal trespass thing, that the court diversion wasn't a risk to the public, which it's not, I don't think, but like, yeah.
Usually it's staffed by our staff and our prosecutors and our investigators. So there, you know, folks who see 800 complaints a year, investigate 750 of them, prosecute 150 of them. They look and they're pretty aware of what the nexus is. So sometimes they come up with debates. Sometimes it's a gray area, and that's when they reach out to the profession and they consult with advisors or the board. If it's a nurse and it's diversion, and it was last year, it's kind of we have concerns about licensing them to have access to drugs again at this time. And that we would do without consulting. So that's kind of an example. We also evaluate that process a lot. So, you know, we've been thinking about whether we ask for the written material right away or, you know, what documents we ask for, because sometimes charging documents from 20 years ago can be hard to find. We've been thinking about making it much clearer on our website and elsewhere that this is not a bar. So it's much better not to lie and, you know, just let's work through it. So, yeah.
Along those lines, as I'm just thinking of all the things that have been said, and I'm thinking about our peer support people in both areas. And I'm wondering, and this isn't necessarily for you, but just to put it out there, is like, how do we communicate to the people that may be coming in to do the certification that this isn't a barrier or an anxiety, so that like this understanding that Brian just got. I mean, I'm wondering how the community will feel about having to check those boxes and answer that. And they may anticipate or feel that it's a bar if they're not hearing this conversation. So I'm just putting that out there as a concern, because I wouldn't want someone that had like a really hard experience, but now is recovered. And that's actually why they'll be so strong in those positions, to feel like this is something that they would feel anxious to disclose to someone, not knowing where it goes or how it's done. So I'm just putting that out there as something to consider.
I think it's a great point. And I think one of the beauties of this is we get to design the training. The Department of Mental Health gets to design the training. Department of Health designs the training. And they know, and I hope that we continue to understand that we can do an OPR day. You know, we can come in for an hour and explain the certification process and really emphasize that. We could do other outreach as well. We've been talking about how to do it, not just for this profession, but other professions. We also have something called a second chance predetermination policy, where before somebody invests in the training or invests in a costly education, they can come in and get a determination from OPR about whether their past criminal history will prevent them from getting licensed afterwards. So they don't undertake, you know, education when it's just not going to be a possibility.
Right?
So, and you may not be able to answer this, but like, I just, as I'm thinking about like, we were talking, you know, that although there's people with lived experience who do all the professions, that peer support and recovery special, I might say the name wrong, but the peer support provider, I think is what it says, recovery specialist,
Yes.
that it's almost like a requirement of the job to have lived experience.
Yeah.
That those of us with lived experience, you know, we do have relapses. We do have like like stuff comes back, especially when you're managing a chronic condition. I'm wondering, and this might be more of a question for others, but like, what resources might we want to be thinking about to give people a chance for to recover if that happens? I know years ago, the first bill I reported was this recovery network that the Board of Medical Practice created. So if a prescriber develops a substance use disorder, they can like go on some kind of plan to not just lose their medical license. Like, do we have anything like that for any other professional regulated providers? So this isn't even just about this profession, but because it could be any of us, but do we have those resources in place or not to help people be able to keep their certification or keep their license if they get help?
Yeah, and I think there's a couple of points there. One, it is not unprofessional conduct to have a mental health challenge or to have a relapse or a substance use disorder. What's unprofessional conduct is to engage in the profession in an incompetent manner. So you have that issue, you're continuing to engage in your profession, you're doing so in a way that injures your clients or your patients or poses a risk. To the latter question, right now we have an alternative resolution process for nursing. That's the only thing we're authorized to do. We've really explored in looking at other states around the country how we might be able to build something out for the other 50 professions that we work. It's complicated, but we have looked into that as well.
Thank you.
So, Ellen?
Okay, okay, these peer supporters that get certified, are they going to be self-employed? Are they going to be employed by someone?
That is a question that we struggle with. We don't know, but I think, but yeah, I don't know. There's nothing in this bill that prevents that from
Sounds
happening.
like it could be either.
Yeah.
That it's open, like it's free, like someone could start a business and be one, or someone could work for Turning Point, or someone could work for Pathways, right? I mean, I see providers not, representatives not in it.
Yeah.
Okay.
So to bring it back to this bill, thank you for all that great information. As part of the rulemaking process, you had laid out all the stakeholders, but specifically through the process of getting to this point over the last couple of years, OPR, DMH, Wilda White Consulting, now VDH, you know, people from the recovery peer, people from mental health, like they will continue to be part of the stakeholder group that moves this forward through rulemaking, correct?
Absolutely. And they're specifically, the Department of Health, Department of Mental Health are specifically named in the bill as OPR is adopting the rules, but in consultation with these agencies. And we cannot do it without them. So we are highly dependent in incorporating those forces.
Okay. Any other questions for Laura?
It's just very specific, like, and I don't know if this was asked in another form already, so if it was, I'm sorry, but do you think the way the bill was written is sufficient? Like, because it matches your other processes, like we don't need to amend it at all?
Yes, I was lucky to be part of the drafting team
Okay.
on this, working closely with Wilda, DMH, VDH, Representative Rebecca, so.
Okay.
Art?
You think it, well, I'll phrase it another way. My hang up with the bill is kind of a smallish hang up, but it's a little bit of a thing, is that we're not certifying all of the peer counselors. What's your feeling on that? And is there precedent for that in other things that you do? And you may have answered this before, but I'd like to hear it again.
Sure. I'm a little hesitant because I just want to say this is me personally, and I guess somewhat from an OPR perspective, but I am comfortable with it. I think the government role here is not to prevent people with lived experience, working with other folks, talking to other folks, offering support and services to other folks. I think it would be really hard to outlaw people doing that. And if you have a license or a registration that mandates that you have some state authority to engage in that kind of, hey, I've had this experience, I want to help you through it, this is what worked for me, you're outlawing pure basic human behavior, right? Empathy, sympathy. And so I think this really is the best form of regulation for this, where you're giving people the tools to find somebody who's qualified in a unique way, that has the training, that has the code of ethics, that has the exam, if there is one, and the background check. Or if somebody doesn't want that, they don't have to choose that. So you're giving some marketplace choice there, and some consumer choice. We do have another example, which is our favorite example. I'm stealing this from Lauren Pepper, is dietitians. Anybody can give you dietary advice. I could tell you what's healthy, the new South Beach diet fad or whatever, that dates me, but whatever, the last time I was healthy. But if you're really looking for medical help and you really want somebody who's got a master's in nutrition and dietetics, you're looking for a certified, somebody you can come to the state, you can look at who has a certification in dietetics. And a certified dietitian, we've verified they have a master's degree, we've verified they have an examination. So you as the individual choose whether to go to Noom, or you can go pay for somebody to give you dietary, scientific medical dietary advice.
All right, my son's a consulting forester.
Yeah.
Can he be one without your state's certification?
A dietitian or a peer support,
Pardon me?
a peer support specialist?
No, can he be a forester without your certification?
No, and that's because of the risk to the public and what you're outlawing, right? He would need to have a license under our current state law, because the harm that was posed was from people who are unqualified, or people who are just going out there and saying they were foresters without any experience or training.
But we're letting peer folks work with people.
Right.
And not certifying them at all. They're just out there. And we have no control over what they do with people. Okay, it's my.
We expressly put in there, no psychotherapy. So we're not allowing therapy, and that is not part of the peer support model at all, or the recovery coach model at all. Heard that very clearly, understand that. So the risk is slightly lower. So you're talking about people with lived experience going out to commiserate, empathize, assist finding case and resources. You're not talking about people going out to provide psychotherapy and rehab.
Okay.
So that's the
All right.
balance.
Okay, Brian, and then we're gonna have a committee discussion.
Okay. I was like listening to like your question and thinking about like some possible examples I wanted to throw out there to see if you would say like, yes, these are examples of parallels, like,
So we've already done that with dietitian, and
so you feel like
I
you
think-
don't want to
I
talk
think
about it. All right,
we're-
fine, I'll drop it.
thank you. I think we're good with,
Yeah,
are we good with examples of,
Okay, we can talk later too if you want to.
if you have a question, great, but if it's just more examples, I think we're good.
I could frame it as a question, but I'll let it go.
Okay, thank you. Thank you, Lauren. Thanks, appreciate your help.
Thank you.
Thank you.
thank you.
Okay, so we have, so yesterday we had talked about adding language around this whole thing to add that rulemaking has to include stakeholders. So that is in here under today with draft 3.1. we also have the draft from yesterday, 2.1, that does not have that include stakeholder language. So I'd like to understand where everyone is based on the conversation we just had with Lauren from OPR, who talked through like who would be involved and how the process would work.
I would make, we can discuss it according to Roberta's rules or whatever, like Lori's rules, but I would make a motion that we accept the previous draft, 2 whatever, based on the testimony we've heard from both advocates and OPR. And then if we want to discuss it, we can, but then this way we have a motion on the table so we can move forward.
Second.
Okay.
Wow.
We could do any discussion, no, and just vote.
So what's the motion?
The motion is to adopt the previous draft, 2.1, was it?
Yes,
Yes.
2.1.
Which does not have the added language.
Yeah,
Doesn't have the yellow.
Exactly. It doesn't have the thing added because we don't need it
it
based on.
has
your-
the criminal background
Right.
history information added that we talked about yesterday, but it does not have the section under rulemaking where we just said include stakeholders.
But that's also, but just to be clear, that's consistent with OPR's practices with other professions.
Right, correct.
Okay, yeah.
And you're saying take that one up for discussion, not to pass it,
I
right?
don't know if that's true
Take
though.
2.1 up for discussion.
Is it true?
Yes.
No,
So
it's
we're
not.
gonna, so we're gonna take,
Let's make sure that.
I didn't know if Lauren said I was wrong when I just said that.
One them into the record with the background checks.
Yeah.
If you, it's not, we don't background check every professional, mostly just for contacts. If we want the authority like we have, it says in the eligibility, if the possibility is there that they want to do FBI background checks, we'll need that
Yes.
authority, which is why it's in there.
Yes.
We don't consistently do it with every,
Other clinical professions?
only with compacts, only with private investigator and security. But again, you know, it's not a foregone conclusion that we're going to do the background check. It's if the stakeholders decide a background check's what they want, we'll need to have the authority to do that. And that this authorizes us to do it, but it doesn't make us do it.
and that is draft
Was
2.1.
that okay with the advocates too?
Yes.
Okay, just want to make sure I'm not, because I want to support what we're putting forward to.
Is that why, the word may is in there?
Yes.
Okay.
Yes.
Okay, we are talking about 2.1.
Okay.
That's the motion on the table. Leslie.
I'm having a hard time, seeing the difference in the language between the two, so if someone could just help me.
So I will tell you.
That would
yes.
be really great.
So if you go to section 3.1,
3.1, so
which is under today, I'm
Version-
sorry, version 3.1, that is under today. I mean, I guess I could have Katie come up. Katie, do you want to come up and do it? Sure. It's one sentence, so I just kind of feel like I can do it, but come on up, Katie.
it's on just.
Oh, it's under today.
Yeah.
Okay.
Katie McLean, Office of Legislative Counsel. Okay, this is 3.1. So this is the only difference between the two drafts, is that 3.1 added a sentence that the committee was discussing yesterday, that in developing the rules required by this section, the director shall consult with stakeholders. So
Got it.
if you are looking at 2.1, same draft, just doesn't have that sentence.
Thank you, I just needed that.
And that's the only difference, right?
Section 2.
Section 5.
Okay.
Yeah, see, I got hung up on section 2.
All right, so let's put 2.1 up, Katie, if you don't mind. Are there any comments, questions, suggestions, open debate on section 2.1 is where we are?
Section 5.
Section 5 and 2.1.
It's getting late.
Exactly.
Right.
Ready to go home.
For Friday.
You mean on the whole draft?
Yeah, so I'm talking now about, are we passing out this bill?
You're giving us one last chance to weigh in,
I'm giving you one last
Yeah.
chance to weigh in on draft 2.1
because there's a motion on the table.
to determine if we're ready to pass this out.
I call the question.
We're gonna have a discussion. Good try, Mari. Daisy.
So maybe Katie can help me find where to put this, but due to the data that came out recently from audit around rulemaking process, I'm concerned about the length of time that it might take to get the rulemaking process done. So is there an appropriate section you'd recommend to insert a deadline for the rulemaking as recommended by that report? Or the committee can consider doing that, or updates on the rulemaking process to this committee?
So I'm not exactly answering your question, but I'll give you some information. So we have that the
Section 5 is taking effect on passage. So Section 5 is rulemaking. So that's taking effect this year, whereas the rest of the bill isn't taking effect until July 1, 2025. So that gives a year for rulemaking to happen. And in Section 5, you sort of jumpstart when you're giving a date by which the initial filing has to be in. So often what we do when we require rulemaking is just say the department shall file rules or shall adopt rules. So here we're saying that they have to file initial proposed rule with the Secretary of State by September 1. So you're giving a date by which the first filing has to be in to start the process.
Great. Art?
We have to talk right now about the language.
No, we can talk about whatever we want to talk about that's related to the bill.
Is there any a peer counselor right now can work for himself, him or herself, counsel an individual, and I guess get money from, get compensated from the individual or from something.
Correct.
We offer the certification. They elect not to take it. They're counseling for drug use. And one thing leads to another, and the past gets dredged up, and that person helps the person at counseling get drugs. Person has an accident, get killed. Would the state be responsible in that instance for offering something but not requiring all peer counselors?
I'm gonna say no. I don't know if.
Sounds stupid, but I worry about that
Yeah.
if we're gonna put this out here.
No. Do you have anything to add, Lauren?
No, it would not, the state would not be like.
Okay.
Frank?
I think I don't know if this is like a charged analogy, but when we talked about crisis pregnancy centers, they offer supportive counseling, but they're not necessarily offering psychotherapy. And if they were, they would have to be they would be on the roster of non-licensed psychotherapists or a licensed psychotherapist. But as long as they're not offering psychotherapy, they can offer counseling person to person. We don't regulate that. They can call it supportive counseling. However, I think if they started advising people about something that's in a regulated profession, then I think the state could go after them for practicing a profession that they're not licensed or regulated in. But we give people a lot of freedom to just give advice to each other as humans as part of our free speech. And I think we call it supportive counseling. But I just wanted to make sure that was one of the examples I wanted to bring up earlier. But I think just to make the point that if a person crosses the boundary and they're starting to advise someone in a capacity that they're not licensed in, then maybe I'd look to OPR. Maybe if they found out that would be, I don't know what the charge would
Well,
be.
we don't know. I think to your question.
Yeah.
If someone chooses not to become certified and something happens, they can't hold the state liable.
Okay.
But the state could go after them if they were practicing something they're not licensed in.
Well, and if they're involved in an
true for
accident,
anything.
yeah, exactly.
Yeah, exactly. That's what my point was. It could be any profession.
All right, what else? Questions, comments? Ready to vote?
I have a question, but I'm not gonna say it. I just want to vote.
I will say I will support this, but I'm not wild about it.
We'll
I
keep,
will support it, but
Thank you.
I'll bet you will come back and someday we'll want to do more.
I'll write that on the record of action.
Go ahead.
Voted yes, but Art's not wild about it.
with explanation. Yes, with explanation.
I like the fact of doing it.
Yes,
Yeah.
we just
I like
want
the fact
everyone
we're
to have
doing
to do it, yeah,
Just,
yes.
but that's fine.
All right, are we ready to vote?
Yes. We can keep talking about it off the record over time.
Yeah, we could keep
Yeah.
perfecting this, and I'm with Art. I want to get it done, but I'm not gonna throw the baby out with the bathwater. I think we could make it better. But I think this is long overdue, and I think we need to get this out so folks can get to work. And I'm ready to make a motion that we pass this.
I think there's a motion on the table still, right?
And you seconded
Not
it.
that was to take up draft 2.1 for discussion.
No, it was to pass it out of committee.
Okay, I second.
Okay.
Okay, please do the roll.
Representative Burbeck.
There is no bill, no, sorry, it's a committee bill right now, there's no bill.
So it's
number.
draft 24-0641, draft 2.1.
An act relating to peer support provider and recovery support specialist certification. Representative Rebecca,
Yes.
Representative Carpenter,
Yes.
Representative Sheena.
Yes.
Representative Cordis, yes. Representative Damar,
Yes.
Representative Farley Rubio,
Yes.
Representative Goldman,
Yes.
Representative Peterson,
Yes.
Representative Black,
Yes.
Representative McFawn,
Yes.
and Representative Houghton.
Yes.
Passes on a vote of 11-0-0.
Great, thanks. And Daisy will be the recorder of the bill. Thank you.
Can we make a
everyone.
motion to adjourn?
You want us to get to the clerk's office today?
It will have to go to Ways and Means because it has a fee. So it's
Let's go to the floor first, right?
yeah, so if possible, yes.
Okay.
So that we just
It
keep
has
it.
to go to, yeah.
No,
It has to go where?
You have to bring a signed copy of it to drop off.
Okay.
That's not.
all right. Okay, so we'll figure all that out after we go.
All
up
right,
here.
so Claire
We'll-
can help us with that.
Yes, exactly.
Then it'll go on the notice calendar and then go to Ways and Means? Is that what happens?
It'll be read for the first time.
Read it for the first time and go to Ways and Means. Thank you.
Okay, so we are done for the day. Thank you, everyone. Next week, we're doing a lot of budget. We're also gonna do a walkthrough of our PBM bill. And we have a couple other things going on, so be prepared to look at numbers. Yes, Leslie.
The PBM bill, is there a most current iteration or are we going with the one that we?
What does it? Introduced. Yeah, page 233, I believe, right, Maureen?
Yes, but there will likely be changes.
But we'll